Hello, you're welcome to day two of our pause awareness campaign. And today we'll be treating symptoms of perimenopause, factors that determines your menopausal age, and certain factors that worsens your perimenopausal or menopausal symptoms. So stay glued and go nowhere. Perimenopause is a crazy period that is very hard to diagnose because hormonal fluctuations. Your hormone goes up in the morning and goes suddenly down in the afternoon and then up again. So it's hard to pick in the lab, but it can be self-diagnosed, or a healthcare provider experienced in menopausal management can equally help you to diagnose if it is perimenopausal symptoms or something else that is causing what you are experiencing. One of the symptoms is brain fog, inability to concentrate on a task for long, or on inability to remember something you did just a minute ago. You find it hard to recall things, to recall events. It could be a sign of, it could be a pointer that you are in perimenopause. Then another thing is dry mouth, tooth decay, change in body odor, um, even vaginal dryness, emotional distress, mood swings, palpitation, because your heart have estrogen receptors. So as your estrogen is dropping and going up, it affects the heart. So it could result to palpitation. Then your period could get very heavy. Your period could get very heavy during perimenopause, and your cycle could shorten or get even longer during perimenopause. If you run a 28-day cycle, it might get to 25 or run to 35. So it all depends. It's a crazy period characterized by irregular period, inflammation, and metabolic issues. There are other symptoms, but these are the key symptoms. Certain factors determine the age you enter menopause. Number one is your genetics. If your mother or elder sister entered menopause early, it is most likely that you will enter menopause early. Another factor is if you have not given birth before. Women who have not given birth before are likely to enter menopause earlier than those who have. Your race or ethnicity can equally be a determining factor. If you're a black woman, it's more likely that you enter menopause early. If you have had cardiovascular disease in the past, it is most likely that you're going to enter menopause in time. Another thing is your age of menarche. That's when you saw your first menses, is equally a determining factor. If you saw your first menses at 11 or earlier than that, it is most likely that you enter menopause in time. Cigarette smokers. If you're a smoker, if you smoke cigarettes or Indian hemp, whatever, if you smoke anything smokable, it is most likely that you will enter menopause a year earlier than you ought to. Then another thing that can quicken your pace at entering menopause is ovarian suppression with contraceptives and surgical removal of one of your ovaries. These things can quicken your pace at entering menopause. If your lifestyle habits revolves around these five key factors, it can worsen your perimenopausal or menopausal symptoms when you get there. Number one is refined sugar. Refined carbohydrates in any form is a no-no because it causes inflammation, and this inflammation can result to arthritis and other inflammatory diseases. Okay, so refined sugar is a precipitating factor to worse menopausal outcome. Is a precipitating factor to is a precipitating factor to worsening. Is it precipitates the worst menopausal outcome. Number two is staying indoors. A little bit of sunlight is very good for you. It activates vitamin D, and vitamin D helps you to absorb calcium. And as you are getting older, from 35, your bone density start going down. But if you expose yourself to a lot of sunlight, not really lots of sunlight, everything should be done in moderation. If you expose yourself to UV rays that activates vitamin D, which helps in absorbing calcium, and you eat calcium rich food, then it could shield you from bone fracture, that the risk increases during perimenopause and menopause, and osteoporosis. Number three is lack of social interaction. We are social beings, and there is something social interaction does to our health. Okay, social interaction could cause the release of oxytocin, serotonin, and all these hormones play a role in our wellness. Number four is stress. Stress, I've already said, I've been on this stress for some time. Stress is a no good for you, especially when you've entered perimenopause or menopause, because you already have cortisol level that is a bit above normal. Cortisol is a good hormone. On a normal day, cortisol is a very wonderful hormone. It helps your body to fight infection, it helps your immune system, it helps you to combat different types of stress, but it becomes a problem when it's above the normal level. And physical stress, emotional stress, and other kinds of stress can heighten or cause a cortisol spike, and this spike in cortisol increases the rate at which you lose muscles and your bones. It increases the rate at which you lose both your muscles and bones. So stress can worsen your perimenopausal and menopausal symptoms. The next is poor sleep hygiene. Some persons can sleep on top of their phone, which is very wrong. Having a poor sleep hygiene, no time, you just sleep spontaneously, wake up anytime you feel you have had your fill. There should be a structure around your sleep. There should be a time for sleeping and a time for waking up. Having a reckless sleep routine, a poor sleep hygiene, can worsen your perimenopausal or menopausal symptoms. Then the last is spontaneous living. Living recklessly. Living recklessly can make you run into a lot of accidents, but when you're intentional about how you live, about how you interact, about the people you mingle with, about the kind of activities you indulge in, it can shield you from some stress, and at the same time can shield you from distressing situation that can worsen your menopausal or perimenopausal symptoms. This is where we draw the curtain today. See you again tomorrow. Bye.